Channel problems, use of distal points. Acute cases. In acute cases, the distal point is used first on its own with a reducing method in order to clear the obstruction of the pathogenic factors and open the channel to make it ready for the use of the local points. A few examples will clarify this technique. In acute sprain of the lower back in the midline, just above the sacrum, one can reduce Du-26, Renzong, first while the patient gently bends forwards and backwards. This helps to clear the obstruction in the channel. After the manipulation of the distal point, the patient lies down and local points are used according to tenderness. These may also be cupped after insertion of the needle. Incidentally, the use of Du-26 as a distal point is an example of a distal point located on the head rather than on the limbs below the elbows and knees. In acute sprain of the shoulder joint affecting the large intestine channel, one can strongly reduce stomach 38. While the patient gently moves and rotates the arm, perhaps with the help of a third person if possible. After manipulation of the distal point, local points are used according to tenderness and according to the channel involved. If the affected channel is a small intestine, bladder 58, in acute sprain of the neck with pronounced rigidity, one can use the point GB39 with reducing method while the patient moves the head from side to side gently. After withdrawing GB39, local points in the neck are needled. The arm-leg correspondence of paired channel with the same polarity and potential is used in the treatment of acute sprain of the joints. This is based on the principle of correspondence between shoulder and hip, elbow and knee, wrist and ankle, and on the relationship of leg and arm channels of the same polarity. That is, lung, spleen, heart, kidney, pericardium, liver, large intestine, stomach, triple burner, gallbladder, and small intestine, bladder. In acute sprain of a joint, one should first all identify the channel involved and then choose as a distal point a point on the related paired channel of the same polarity and potential on the other limb, and often on the opposite side. Some examples will clarify this. In acute sprain of the wrist, one would use a distal point on the feet, choosing the channel on the foot related to the involved channel of the wrist. For example, supposing the main tenderness is on the point TB4, one can choose the leg channel related to the triple burner channel with an upper-lower relation. Example, the gallbladder channel. On the gallbladder channel, one would choose the point with a corresponding location to the wrist point. Example, on the ankle joint. This would be GB40. Supposing the main tender point is lung 7. The point used on the foot would have been spleen 5, based on the correspondence between wrist and ankle. If the sprain had been on the elbow and the main tenderness on LI11, the point of the foot chosen would have been stomach 36. If the tenderness is on LI15 in the shoulder, the point on the leg chosen would be stomach 31. Based on the correspondence between shoulder and hip. This illustrates in figure 70.12 the correspondence among points of the bright yang channels according to this theory as an example. As mentioned above, according to this method, these distal points are often used on the opposite side, bearing in mind the above correspondences between joints and the related leg and arm channels. We can make a table of related distal points to use for each joint according to the two above correspondences. As the table notes, correspondence of points to joints of the upper and lower parts of the body. The joints would be on the shoulder. So large intestine on the arm would be LI15, on the leg, stomach 31. Joint would be the triple burner. On the triple burner on the shoulder would be triple burner 14 and GB30 on the leg. For the small intestine would be SI10, and on the leg, bladder 36. Again, on the elbow, LI11 on the arm and stomach 36 on the leg. On triple burner, it would be triple burner 10 and GB 34 on the leg. SI8 on the arm and bladder 40 on the leg. For the wrist, it would be LI5 on the arm and stomach 41 on the leg. Triple burner 4 on the arm, GB 40 on the leg. SI5 on the arm and bladder 60 on the leg. On chronic cases, the combination of distal and local points in chronic channel problems is also nearly always used, and in this case, local and distal points reinforce each other's actions on the channel. The main distal and local points are the same as those indicated above. Thank you for your attention.